Ever wonder what happens during a Brazilian butt lift in the surgery? Well, I'm gonna take you through today a Brazilian butt lift starting in the morning to the end of the case so you can see exactly what happens. I'm Dr. Michael Gartner, double board certified plastic surgeon, and today I'm gonna take you through a case of a Brazilian butt lift. So here's a lady who is 31 years old. She's in great shape, but she has some fat pocket. She told me she wants a curvier hourglass shape. There are different shapes of the buttocks. She actually has a little bit of a V shape. Okay, so today's case is a Brazilian butt lift. We're going to try and reshape this patient's body a little bit. We're going to take a little bit of fat off the front, try and sculpt the sides, snatch the waist, and fill up the top part of the buttocks as well as the sides. Let's take a look at our preoperative photos. She has some asymmetry where this side's a little bit bigger. Okay. So here are preoperative photos. She has a little bit of asymmetry, as I pointed out. No two sides of the body are ever the same, whether it's the face, the buttocks, the waist, or anything else. So those need to be checked out beforehand and observed so that we can compensate and try and make you as even as possible. And sometimes that's possible, sometimes it's not. As I said, this woman almost has like a V-shaped kind of buttocks, close to a straight, but more of a V-shaped buttocks a little bit. And we're gonna clean out that waist, clean out the back, and then fill in the hip dips and give her volume. So we're going to try and snatch this as best we can here. Try and get rid of some of this here. And then we're going to try and fill this out here. Try and give her more fullness in this area. Okay, so we're going to start here. We're trying once again cinch your. So this is being done under anesthesia. At this point, this lady has been prepped and draped. We put her in the special side position with special pillows, so it's very safe. She also has compression boots on to massage her legs to prevent any issues of blood clots. I like now performing the SAFE lipo. It stands for separation, aspiration, fluid extraction, and equalization. The first step is to inject the fluid, and separation. You separate the skin from the connective tissue. Then you do the aspiration part, and then you do an equalization part to smooth everything out. This does take a little bit longer in the operating room. This works much better than laser liposuction or anything else out there. So here I like coming at it from two different angles to really make sure I clean that area out. Okay, here she is before with her abdomen. Now we're going to make her a little bit flatter. Now we're going to repeat the SAFE lipo process on her abdomen. Okay, now you can see here our abdomen is really super flat. Really looking nice. Beautiful result. Now that our abdomen is much flatter, we're going to go to the other side, repeat the next process on the opposite waist and back area. Snatch the waist on this side, make this flatter, then we're going to inject the fat here and then the buttocks to give her a beautiful, better contour. Now you can see the waist is nicely snatched. It's beautiful curve here. She'll be really happy. So now you can see amazing difference. She has curves. And so now we're going to put her in the proper position and inject the fat in the buttocks. Okay, so now we're going to inject the fat. We're going to try and fill out this area here and give her more fullness. So right now, it looks like I'm doing liposuction, but I'm actually injecting the fat. I use a power system on a very low power to slowly inject the fat so it's precisely placed where I want it. Okay, so as you can see, I go back and forth to both areas, distributing the fat as equally as possible, checking symmetry at all times. So here she is before, and here you can see the afterwards on the table. So here you can see she has this nice hourglass shape, nice fullness on the side, beautiful perkiness here. Beautiful result. So this lady now has shape. She can wear dresses she wants to wear and show off her curves, and she's a very, very happy patient. So if you're interested in discussing more about this, come and call my office or send us an email. If you like this video, hit the subscribe button and the like. Stay tuned.